everyone, how's it going? It's me, Jaylene, also known as FemmeForth. I'm a sexuality coach based here in Vancouver, Canada, who helps people not only with their kink lives, but sex lives as well. And today, we are getting cozy with the topic of chlamydia. Ayo! I'll be discussing chlamydia with 3 key things. Number 1, what is it? Number 2, how is it transferred? And lastly, number 3, 3 key ways of navigating chlamydia. Number 1. What is it? Chlamydia is basically an STI caused by a certain bacteria called Chlamydia trachomatis. This bacteria generally infects the throat, genitals, or the anus. However, if the infected bodily fluid, which I will be discussing in number 2, come into contact with other mucous membranes such as the eyes, they are also vulnerable to receiving this bacteria. Chlamydia can be asymptomatic, but if there are symptoms arriving to this party, they will look like, for vaginas, white, gray, or yellow discharge, burning sensation when peeing, ouch, pain during sex or bleeding in between menstruation cycles, or just an overall pain in your lower abdomen. For the penises, mucus or clear and watery discharge from the penis, and also a burning sensation when peeing. In the anus, it can be some rectal discharge, pain, or bleeding. And lastly, in the lovely little throat. This is a tricky bacteria. It's going to basically feel like a sore throat, much like many other throat infections. Sneaky, sneaky. But it also goes to show how much it generally just is a bacterial infection, just like any other throat cold we get or any other cold we receive in our lovely little bodies. And alas, chlamydia is a popular one. It's actually the most popular bacterial STI in the world, and the navigation of it is pretty easy, so make sure to stick around for number 3 for my tips on that. Alright, number 2, how it is transferred. Chlamydia isn't transferred through any other bodily fluids except for vaginal fluids and semen. If it's in the eyes, you probably touch some chlamydia positive body fluids and then rubbed those sweet little eyeballs. Or someone's body fluids just squirted in your eyes. And if it's in the throat, you most likely gave unprotected oral sex to someone who had it. Alright, the most important now, number 3, 3 tips on navigating chlamydia. Once you're tested positive for chlamydia, the medical system will generally ask you for all the contact info of all the partners that you have had unprotected oral or penetrative sex with since your last STI test. Certain medical systems on your behalf will reach out to these people to let them know in a very anonymous manner that they should be tested for chlamydia as well. And if your medical system does not provide this anonymous disclosure to your past partners, then you, my friend, must do this yourself. Be a good human. As awkward as it may feel in the moment, trust me, I get you. These people would probably much more appreciate the heads up of getting their house sorted than leaving this untreated. As a not so fun fact, if left untreated, chlamydia can provide pelvic inflammatory disease or pregnancy complications for vaginas. It can create painful swelling and infection in the testes, and as well can increase infertility risk for all sexes. So alas, do the ethical thing and prioritize other people's health above your own ego. Number 2, stay celibate for 7 whole days. The amazing thing about chlamydia is that there are antibiotics for it. Praise science, and the treatment only lasts for 1 week. So to keep your new or current partners safe, opt out of sex for 1 week or until your symptoms have disappeared, and opt for some cute little close cuddling instead. Cooch stuff. And alas, number 3, have no shame. I understand that this isn't fun. I can personally say that I have been there myself. In my early 20s, I received one of these anonymous, wonderful calls from a nurse telling me that I had been exposed to chlamydia. The thing here you have to realize is that you honestly have not done anything wrong as long as you follow those first 2 tips I just told you correctly. Bacteria happens, and it's not a declaration on who you are as a sexy human being. And if you're having issues with feeling sexy or worthy with either STIs or just your own insecurities, I'm here for you. If you're suffering from a lack of confidence like my past coaching clients have, I offer free one-on-one intro calls to those who are wanting to explore and get back on that path that you are craving to be on in your sex life. To set up the free one-on-one intro call to see if we're a good fit to work together, head to my website, the link is below. And don't forget to spread all the sex ed knowledge by liking and subscribing. Thanks so much for watching, everyone. It's me, FemmeForth. Mwah.